Hi, my name is Dr. Meyer. I'm from Carolina Conceptions in Raleigh, North Carolina. And I'm going to talk to you today for a few minutes on the rare but unfortunate circumstance of women developing breast cancer between the ages of 30 and 40. Now, I said rare, but it's not as rare as we would think. There are about 200 women a year who are diagnosed with breast cancer, and they are between the ages of 30 and 40. Why is that significant? Because many times the treatment for breast cancer in these young women prevents them from being able to have children at a future age. So only about 20 of those 200 women will ever be able to have children again. So we here at Carolina Conceptions are available to try to enhance a woman's chance of having a child after she is diagnosed with breast cancer. So how do we attain this goal? Well, the first is education. And who we're trying to educate first are the physicians who see women with breast cancer. And that is the group of medical oncologists in the state of North Carolina and specifically around Raleigh, North Carolina. We've educated them in the sense that they know how to obviously take care of breast cancer, but we want to let them know that we can take care of you as a patient in the sense of hopefully being able to freeze eggs or freeze embryos on you and then allow you to go through your treatment for breast cancer. So the first is to allow the medical oncologists the ability to refer patients to us on a fairly rapid basis. So our front desk knows that when medical oncologists call and refer a patient to us, or if they call our office, we're going to be able to get you, the patient, in within just several days, if not that day itself. We also not only expedite your entrance into our office, but we also want to talk to you about the affordability of doing treatment. And that affordability is also enhanced and will be discussed later by one of our financial counselors. But there are the infertility pharmaceutical companies that are aware of this problem. They're aware of the stress that this imposes on women who have just been diagnosed with breast cancer, and they're going to do everything they can do to lower the cost. In fact, many of them provide the medications free to patients who are going to need egg freezing or embryo freezing. And of course, we hugely discount our services too for patients who have breast cancer. So what's the first thing we can do when a woman's diagnosed with breast cancer and she's going to receive chemotherapy or radiation? Well, one of the things we try to do is protect the ovary, and one of the things that medical oncologists can do is give the woman a medication called Lupron. And Lupron will decrease, it will actually turn off the ovaries. It usually takes several days to do that, sometimes 7 to 10 days to do that. But it will actually cause the ovary to go into a temporary menopausal state. And what's the advantage of that? Well, when the woman takes chemotherapy, the chemotherapy will actually enter the ovary at a much lesser degree. And there have been studies to show that ovarian reserve or ovarian potential, the ability to produce eggs, is conserved more when women get Lupron therapy or a medication that decreases the blood flow into the ovary. Now, what are the options for women then who are diagnosed with breast cancer and in their imminent future they're going to receive radiation or chemotherapy? Well, there are three main options. One is actually removing the woman's ovaries and conserving her ovarian tissue for possible transplantation at a later time. We do not do that here at Carolina Conceptions. The other two are probably more realistic options, and those are egg freezing and embryo freezing. Now, both of those require that the woman go through in vitro fertilization. So I just wanted to briefly talk about that. So when the woman is diagnosed with breast cancer, we, depending on where she is in her cycle, we will start the stimulation of her ovaries. Now, we can bring, if a woman is in the wrong part of her cycle, we can either wait until her period starts, or we can actually induce that part of her cycle. And it's not worth going over on this video how we do that, but we put her into the beginning of her cycle, and then we stimulate her ovaries with medications. And those medications involve oral medications and also injectable medicines. And what we're trying to do is have the woman produce as many eggs as she can during that 1 month period, because afterwards she's going to be exposed to her chemotherapy. So what we do is, at that time, we use injections of medications, and we also use a medication that stimulates the ovary but keeps estrogen levels down. So we know that estrogen is stimulatory for breast cancer. So one of the medicines we use is letrozole or Femara to actually stimulate the ovary but keep the exposure of the breast to high levels of estrogen to a minimum. In fact, letrozole tends to let the ovary produce eggs but keeps estrogen levels low. So a woman usually gets about 8 to 12 days of injectable medicines and also the letrozole to keep her estrogen down. And we monitor her progress by doing ultrasounds and getting blood work, but mainly the ultrasounds are the most important. After 12 days of therapy, the woman receives a final injection that matures the eggs. 36 hours later, we actually retrieve the eggs. And the way we do that is, in the clinic, the woman is put to sleep by a nurse anesthetist. We actually go through the vagina with the ultrasound and place a needle into each ovary and drain the fluid, and each follicle contains an egg. Now the question is, what do we do with the egg? Well, if the woman is freezing her eggs, then what we do is we clean the egg off, and then we go through a freezing process. And this is called vitrification of the egg. Now, egg vitrification is no longer considered an experimental procedure. Approximately 5 years ago, it was deemed by the American Society of Reproductive Medicine no longer to be investigational or experimental. So if you are a patient who's going to undergo egg vitrification, you need to look for a program who has embryologists who do an excellent job at freezing eggs. And here our embryologists do a terrific job of that. In fact, we even freeze eggs in patients or egg donors, and we freeze eggs for other programs, specifically programs in Washington, D.C., who need donor eggs frozen. So our embryologists have gone through various certification and trial periods to develop their expertise in freezing eggs. Now, the egg is one of the biggest cells in the body of a woman, and the problem about freezing the egg is egg is getting the antifreeze within the egg. The cell is so big that when we freeze the egg, there's that propensity to develop ice crystals within the egg. So vitrification does prevent that or lessen the degree of that, and it has come a long way in the last 10 years. So if you're going to consider having egg freezing, go to a program that has a very good reputation at freezing eggs. Now, if the eggs are frozen that time, obviously there's no sperm involved. We freeze the eggs are placed in the freezer, and 5 years later is usually the time when those eggs can be inseminated by the woman's significant other's sperm or a sperm donor's sperm. In that case, actually sperm is injected within the egg in a procedure called ICSI. But that's beyond the scope of this talk. The other option, along with egg freezing, is actually to freeze embryos. Now, embryos are fertilized eggs, so now we've taken the eggs out, we actually inseminate them with the significant other's sperm, and we let those fertilized eggs actually grow out to 5-day embryos, and those embryos are called blastocysts. And those blastocysts are frozen at that stage, and then those can be used in a future time to be transferred back into the woman after she has been treated for her breast cancer. Now, which is the most successful? Well, embryo freezing is the most successful. The embryo is about 100 cells on day 5, and it's much easier to get the antifreeze into the embryo to freeze it at that time. So there are 2 options for women who are going to undergo chemotherapy for breast cancer. One is to do egg freezing, and the other is to do embryo freezing. Now, after that procedure is done, the woman is going to have to go and get her treatment for her breast cancer. Again, we can treat the woman with this medication I mentioned in the beginning of the video called Lupron. That medication will decrease the blood flow into the ovary so that hopefully the ovary will be more resistant to the chemotherapy. Well, I hope this talk has been informative to you. If you are a woman who has been diagnosed with breast cancer, there are definitely options out there for you to preserve your fertility. Here at Carolina Conceptions, we feel that we're experts in freezing eggs and freezing embryos, and hopefully these could be used by you after successful treatment for breast cancer. Thank you very much.
Hello, my name is Shannon. I'm one of the financial coordinators here at Carolina Conceptions. Today I'm going to talk to you about the financial side of an egg freezing cycle for our cancer patients. We provide discounted egg freezing cycles for our cancer patients and work with pharmaceutical companies who will often provide many fertility medications for free or at a discounted rate. Your first step will be to schedule a consultation appointment with one of our physicians. When scheduling, let the front desk know that you've been recently diagnosed with cancer, and we will get you in as soon as possible. After your consultation with the physician, you will meet with one of the financial coordinators, and we will go over the cost of an egg-free cycle and your financing options. The average cost of an egg-free cycle will be around $5,500. If a loan is needed, we work with CapEx MD. Otherwise, we do accept Visa, MasterCard, and Discover, as well as personal checks. If egg freeze is an option for you, we will arrange a nurse education class. At the education class, you and one of our wonderful nurses will map out your calendar for treatment. In the financial department, we will start submitting the proper paperwork to the pharmaceutical companies to get your medications delivered to you according to your calendar, made with the nurse class. Here at Carolina Conceptions, we're here to keep this process as easy as possible for you. If you have any questions or would like to schedule an appointment, please contact our front desk and we are here to help you.